Well, as far as, I think you made a key point that the question whether health care is a right that we're entitled to, or whether it's something that we should have to pay into. It seems to me the logical answer would be that for about 15 or 20% of the population that are just having tough luck and there's not much they can do about it, that we make it a right. And for the rest of it, if we don't buy into it and we don't follow the rules, then it's going to be tough luck. Do you think that's the way it will play out over the next few years? Or
I guess ultimately it depends on your view of what the population of the U.S. is, but
20,
10 to
25 or whatever, I don't know what the
million.
number is.
You kind of get there. So it is true that and in a society where we live very well in the United States, we have access to probably the best health care providers of any country, the latest innovations in surgical procedures and medication and all of those kind of things. There's certainly big advantages of being a consumer of healthcare services in our country. The challenge is all of those services are becoming more expensive. The provider organizations are struggling to make money as well. We are coming out of recession, as you brought up earlier, but still the recession has reduced the roles of members on a lot of these payers' rosters. Right. And it's a very complex challenge to provide something that, I mean, who wants to see somebody be sick and not get be provided the health care that they need? But it's expensive. And we're also a society that's somewhat decadent. If you look at obesity and diabetes, which are correlated to each other, and people don't live healthy lifestyles, and that drives up the cost for everybody, and that's a challenge.
Do you see some of these new dynamics, if you fast forward, going more toward one payer or socialized medicine, if you looked out 10 years from now or 20 years from now?
Yeah, it's going to be interesting. One of the things that could have happened, I don't know if it would have made it through our government, but a single payer system or socialized medicine, a la the Clintons were trying to push years and years ago. The steps that were taken in the Reform Act are definitely steps in that direction. When you start to homogenize what the products are, what benefits are, when you start to remove lifetime limits and some of those things, it doesn't really provide an omen that it'll happen, but it certainly makes it easier to get to socialized medicine.
It feels like it's walking that way.
It looks that way. When you can procure things through exchanges that are state-run, when the federal government is subsidizing a very large population for their health care insurance, when you have homogenized products that are commoditized, it makes it much easier for the government to take over. I don't know if that'll happen, but it's certainly a step in that direction.
From your perspective, with your years of experience, how big a problem do you feel it is with the avoiding the lawsuits, the malpractice? I mean, you'll hear numbers, it's only 1 or 2% if you're looking at the actual lawsuit numbers, but then you hear that maybe it's 30% because of all the doctors doing things that really might not need to be done. They're just protecting themselves. How do you see that?
Yeah, we definitely have part of the things that are broken in our system, again, in my opinion only, I guess other people
You're
should.
an expert. That's why you're on the show.
And my brother's a doctor. Malpractice insurance is a very high cost of doing business for physicians, and the limitless lawsuits and frivolous lawsuits definitely drives up their propensity to do more tests than they necessarily need to. But I think we have a system that pays for volume and intensity of care, not the outcome of the care. So if you're a hospital today, unless in certain cases this isn't true, but by and large, a readmission for you might be a really good thing. You make more money, right? For the payer, a readmission is catastrophic. You have to pay for additional care that you didn't necessarily need to pay for. Now, I'm not saying that hospitals do steps to not do that, but you never know what's going to happen when finances are in play.
And you have to worry about a MRSA infection every time you go back to a hospital, et cetera, so you want to stay out of them, right?
In theory, yeah, you definitely want to stay out as much as possible. But it's so complex. And I think what is interesting about the Reform Act is it's really healthcare insurance reform. It's not necessarily as much or so much healthcare reform.
Very good point.
It's not changing the way that care gets delivered. There are demonstration projects and things like that are in there. There's mention of accountable care organizations and physician-centered medical homes, these things that really could drive down costs of delivering service, and that's not really at the forefront of what this bill is about.
Yeah, I wonder if if the healthcare reform will come about because of the insurance reform, or if that basically hinders that.
I think it's a logical next step. I think it's politically it's probably harder for the government to go after and say, here's how care should be delivered, than it is to say these insurance companies are paid too much money. Which is kind of interesting. I don't know if you saw this or not, but the Wall Street Journal, a recent CEO compensation, the top industry was healthcare.
Yeah.
Right.
That's a little bit falsified in that it's not necessarily the healthcare payers and providers that are on that list. It's more
Probably
conglomerates,
everything.
Boston Scientific and things like that.
Well, in the minute left, and it seems like we just scratched the surface. I feel like 2 minutes has gone by and the show is ending. But do you feel that this healthcare bill will be modified and kept in place, or that they'll get rid of it and start over again? And if they do just eliminate and start over again, think it would be another several-year delay before we really can start fixing this problem?
I believe that the pain that was gone through to get the bill to where it is, the process itself, and the fact that the recent election certainly didn't favor the Democrats, but it also didn't change the full balance of power yet.
Right. No.
That being the case, I think there won't be enough momentum to change it. I think the regulations that get written may get watered down somewhat and provide a little more Republican flavor.
Yeah.
But by and large, I think the bill will stand as it is today until at least a new regime, until there's a regime change.
Certainly, because you got the veto power.
Yeah.
Well, I wish we had more time to pursue this with you tonight, and I hope you'll come back, because this is really an important, for our viewers and listeners, probably the most important thing we can talk about, and you've given us some really fascinating insights. John Wollman, Executive Vice President of HighPoint Solutions, thanks for being here tonight.
Thanks for having me. I'll come back anytime.
All right, great. Okay, well, our special guest next week is Patricia Tawardos of I Woofed Up. She motivates kids to do the right thing, and there's probably a lot of viewers and listeners that have children or grandchildren that might want to listen to her next week. We hope you'll stick with us. As far as you're concerned, our money matters.